Dr. David Peterman is a primary health medical group expert, Idaho's largest independent primary care and urgent care system, and he is joining us tonight live from Boise. Doctor, thank you.
Oh, Marnie, thank you for having me. It's important to share with your viewers what exactly is going on here in Idaho and, of course, in the other states that you referenced in this report.
It's a crisis for sure. Are you at the point where you're turning people away?
Well, what's a little bit different than your report is we're in primary care. We have 21 primary care clinics. We do family practice and urgent care in our clinics. In the last 3 weeks, the demand for services have been enormous. The phone calls coming into our clinics, normally we get 40,000 a month. Now we've had over 80,000. The number of tests we need to do for COVID, again, overwhelming. Because of all that, we just cannot keep up with the demand. Also, on top of that, our own employees, just as was referenced, 91% are vaccinated, but they are having breakthrough infections as their children go to school. The schools here don't have consistent mandatory mask policy. And therefore, on a daily basis, 30 to 40 of our employees are out with either a positive COVID test or waiting for the results. And therefore, we cannot keep up with the demand. We've had to close our clinics early at 7 p.m. Normally we're open till 8 to give the staff and the doctors time to catch up so they can come around back at 4 a.m. to do it again. And on the weekends, we've actually had to close 3 clinics. In a sense, Marnie, we are denying care. We are, in a sense, having to turn people away. This is absolutely heart-wrenching. As someone who's practiced for many years and have been in primary care, I can't imagine closing the doors and saying, I can't take care of you.
Right? I mean, we keep hearing these terms, crisis standards of care. Haven't heard that too often before. Rationing healthcare. So medically speaking and morally speaking, how do you decide as a doctor who to treat and who gets a bed?
Well, I don't know how to answer that in the best way, but what happens in our clinics, you literally are treating the person in front of you. And at some point, again, we have to close the doors. At some point, we can't answer every phone call. And we're trying to explain that to our patients. And ultimately, it's a plea to our community, which is those that are eligible get vaccinated. Everyone should be wearing masks indoors and in any kind of crowded situation, indoors, outdoors. That's what we're asking for right now. And what you described is absolutely a very difficult question in a sense of who do you treat first. And currently, you have to look at it in terms of who's right in front of you.
Right. The governor, Dr. Peterman, Brad Little, activated the National Guard in your state, allocated $10 million for hospitals and nursing facilities. But we're still hearing this cry for help, that we need more help, we need more support. So what more can be done right now? Well,
right now, what we need is people. We need people to answer the phones. We need trained people who know how to triage patients, help us evaluate them. And of course, we could always use more doctors, nurse practitioners, and physician assistants. Right. We've made that plea to the governor and to the federal government, and we're waiting to hear back. We have gotten a quick notice that we will be getting some of the National Guard, and that certainly will help us. And we're thankful that the governor has done that for us.
Dr. Peterman, I want to play a soundbite from a nurse in your state exhausted by what she's seen. Take a listen.
Everyone, all of our COVID patients are unvaccinated that I've taken care of, and it's so disheartening that these families are so sad, and they all ask, well, what could I have done? Will the vaccine save them now? No, but you could have done that before.
Doctor, what is the emotional toll that this surge and what you're seeing in your state having on doctors and nurses and frontline healthcare workers?
You know, as a manager, I have to figure out not only how do I replace people, get enough people there, but I have to deal with just what you've described. At some point, you cannot motivate people anymore, and they are exhausted, and in a sense, they become numb. And on Wednesday, we had our all-company Zoom meeting, and I simply said to them, I need your help. There's nothing more I can say. This is what we do. We are healthcare providers. We have to do the best we can. And it's very, very challenging. And I will tell you, for all of us, it's very frustrating when we're confronted with a patient that is not vaccinated. And we're particularly upset when we hear whether they are public leaders or supposedly scientists that give out false information. It's just makes us extremely upset. It's very clear. We need people to be vaccinated and to wear masks unequivocally.
Right. So I'll take the chance that somebody watching on the other end of this television tonight is not vaccinated, does not want to get the vaccine, has some legitimate concerns safety-wise about the vaccine. Speak directly to them tonight. How do you convince them in medical terms and emotionally to get the vaccine and get the shot?
Well, here in Boise, look, we need to think beyond ourselves. You need to think about your family, your neighbor, parents, grandparents, or those that you don't know. And the whole idea of getting vaccinated, you're not only protecting yourself, you're protecting others. The other idea of wearing a mask is you are protecting yourself and you're protecting others. And so what I would say to that person, there's enough science all over the world to say that vaccines are incredibly safe and have very, very rare serious side effects. And we all need to be thinking in terms of our community and how we can help each other. And that starts with wearing masks and getting vaccinated.
Dr. David Peterman, thank you for the work you're doing, and thank you for joining us tonight.
Marty, thank you so much for giving me the opportunity to speak. And again, whether you're in Idaho or Alabama, get vaccinated.
All right, appreciate it.